Good afternoon, everyone, and thank you for coming and tuning in online. Ordinarily, I hold press conferences on Monday, Wednesday, and Friday mornings to keep people informed about what everything is happening in St. Louis County, especially related to the COVID-19 pandemic. But today I want to address an issue of urgency for everyone in our region. We rely on our schools. We rely on them to teach our children, but of course without schools, parents can't go back to work, and some kids don't have anything healthy to eat. Our businesses need schools so the parents can come back to work, and our businesses also need schools because they're training our future workforce. So we all have a stake in the success of our schools. Since the pandemic has arrived, St. Louis County Public Health has been working cooperatively with superintendents, public health experts, pediatricians, teachers, and others to develop guidelines. Unfortunately, this spring, schools had to close due to the pandemic to keep the kids safe in our community. Since that closure, this working group, superintendents, public health experts, teachers, pediatricians have been working together on a plan so kids could go back to school this fall. That conversation continues even today. I hope that we can all agree that the discussion on how we reopen schools must keep the health and welfare of our kids, teachers, staff, and their families at the top, utmost priority. And that's the priority that has guided all of this work on back to school plans for this fall. Our school leaders and our teacher representatives, our public health experts, all share those priorities, the health and welfare of our kids. And I'm encouraged that all the school districts in our region are working together on their back to school plans. And I'm told that we should still expect more details from each school district next week. I'm strongly encouraged, and I'm strongly encouraged by this work that's happening, but I also want to emphasize that I strongly encourage each school district to offer a virtual option to parents this fall. I'm asking the school districts to give parents as much notice as possible concerning their plans and their back to school preparations. I know that virtual school is not ideal. Access to technology is not evenly distributed across the county. We know that, and we're working to close that gap. That access is an important piece of moving this forward. Also, kids still need to eat, and we know that many kids do not have access to breakfast and lunch at home easily and depend on our schools to provide those meals. And county government is doing everything we can to address these gaps that our schools depend on to take care of our kids this fall. We have designated $5.9 million to child care grants and support. We've designated $2.6 million to meal and food support. And we continue to look for opportunities to join other partners in making sure that the technology gap that some schools will face is closed so that virtual school will be an option for all parents this fall. Yesterday, I spoke to Governor Parson about the importance of virtual option for parents and making sure that schools have the funding and revenue stream so they can operate and they can offer this option. For those kids who wind up in a physical classroom this fall, we have to make sure that they're safe. St. Louis County has distributed 74,800 masks to schools, and we are ordering more. We're also working to make sure that schools have thermometers that they need, and they have screening processes in place to keep teachers and kids safe. And for all the parents that are out there, I want you to know that we're going to make sure that all the schools have all of the equipment, thermometers, masks, protocols, procedures to minimize the risk of transmission to parents, to kids and teachers and families and their parents through the schools. And if everyone, for those who don't have kids in school, just remember, parents can't do this alone and schools can't do this by themselves. We all rely on our schools, and we all have a responsibility to make sure our kids can get through the coming months. I'd also like to talk about youth sports. St. Louis County has the most contact tracers, the most robust contact tracing in the state. We have over 300 individuals dedicated to this process, and we're onboarding more every day, working on contact tracing and working on case investigation. So here's how it works. When St. Louis County finds an outbreak, our contact tracers talk to everyone who's been exposed. We set up recommendations on quarantine, testing, and treatment, isolation if necessary, and make sure that everyone has access to a test who needs it. We take these outbreaks very seriously, and we track these outbreaks because they guide our policy decisions. Lately, our contact tracers have noticed a disturbing trend. A lot of new cases of COVID-19 are tied to activities around youth sports. And here are a few examples. One local high school has reported cases involving student athletes. One case, 15 students on the same team are in quarantine awaiting test results after one student athlete on that team tested positive. Many young people and their families have tested positive after attending athletic events, youth sports outside of St. Louis County, including one 9-year-old student athlete. An alumnus of a local high school has tested positive after playing basketball with 16 other high school students. Those 16 high school students are now in quarantine. Statistically, the rise of COVID-19 among youth is stark. We've seen the rise of cases, especially in 10 to 19-year-olds, and even as young as 9 years old or less. Currently, we're averaging over 20 cases per day in St. Louis County in kids aged 10 to 19. 4 new cases per day in kids under 9. And in all total, we have over 700 cases of COVID-19 in young adults, young people under age 19 in St. Louis County. So we're going to start rolling back the rules surrounding youth sports. Effective Monday, youth teams will only be able to practice and play with their own teams. There won't be any competitive play, and groups will be limited to 10 or less. There will be no spectators, and no one will be gathered around to watch. And let me be clear, the youth sport is not the problem. As a parent of an avid cross-country runner, I can assure you that I get it. Youth sports is very important. Sports are one of the most important ways to learn responsibility, discipline, and teamwork. But because youth sports bring people together, the activities that surround youth sports are fertile ground for viral transmission. Kids practice together, they play together, they socialize together, they hang out on the sidelines, people gather to watch. And I know that there are many families, many teams that have worked really hard to follow the guidelines and follow all the recommended precautions. And these changes will deeply affect them. And for that, I am truly sorry. But it's my duty to do what's necessary based on expert advice to look out for the health and welfare of everyone in St. Louis County, including our kids. We will continue to watch the numbers, and we'll continue to keep you informed about what's happening. We know that we can reduce the spread of COVID-19 in our school-age population, and we have to do everything we can to reduce the spread and to make sure that an in-school and in-class school is an option for parents in this fall. And I'd be glad to take any questions.
Mr. Buck, who's, you may know Dan Buck, he runs the sports place out there. He says that you all are lying, that there are 0 cases among 12,000 athletes they surveyed. They don't think there's any evidence to support what you're saying. And in addition to that question, the 700 infected, were they since the beginning of COVID or just recently?
700 to date. Recently, we're seeing 20 new cases in the 10 to 19-year-old range every day.
And the 700 was youth 19 and below in the last 2 days?
No, 700 since the beginning of COVID-19 in our region.
Okay.
20 per day. The explosion of youth cases has really happened recently across the country, and here in our community.
And what do you say, Mr. Buck?
People call me names every day. I don't know how to respond. I certainly can't respond to everyone who does that. But there are people who are unhappy that COVID-19 has affected them personally, and everyone has a perspective. From a loss of life, someone who loses a loved one has a perspective. Someone who is sick and in the hospital has a perspective. Someone whose business is impacted by the lack of traffic because of COVID has a perspective and will be disadvantaged and will be vocal about it.
But his underlying argument there about you don't have the numbers.
That's not backed by any form of data. It's a response, it's an opinion. Our health department keeps track of data across the board, many infections, many different types of things, been doing it for decades. They do what they do every day. This is real.
Can you elaborate on the 20 new cases a day, Sam, whether it's sports-wide, who are, what make up
20 new cases a day in kids that are 10 to 19, 20 new cases a day, and there's not going to be less tomorrow or next week. This is going in the wrong direction, and we have to do something about it while we can impact that trend. This is a trend, and it's going up, and it's going up quickly across the country in this age group, and it's going up here in our region. Our contact tracers track these cases, find out where they've been, and put the puzzle pieces together and help us determine where the risk is. And that is the agreement we made when we opened back up gradually and slowly, and we're now at 50% capacity in our businesses. We have no plans to expand that capacity anytime soon. We're going to hold here. We're talking with the pandemic task force and our regional leaders about whether or not we'll have to have other restrictions. But the agreement we made early on when we reopened was that we would look at sectors where there were outbreaks and look at individual businesses where there are outbreaks and respond to those businesses or respond to sectors. And this is a trend, 10 to 19, that is dangerous in our country. It's dangerous in our community. And if we don't get our hands around it, it will impact the option of in-class school in our community. And we're having the conversations right now with our school leaders, with our public health experts about what school looks like. And part of that conversation, I hope, will be to make sure that virtual school is a possibility for parents who want to see that.
A couple questions. What happens when a student, a teacher, or staff member tests positive for coronavirus once the school reopens in the fall?
Well, what would happen, those guidelines are published at stlcorona.com, general guidelines for schools, and those were guidelines that were developed with superintendents, public health experts, and doctors to determine what the best practice were in general. Schools will have the option to make those more specific to each school district, but in general, anyone that's tested positive is removed from immediately removed from any sort of ability to be around anyone else. Their activities are tracked, and everyone who's been exposed to them and length of time that our contact tracers think that put them at risk for a transmission, those folks will be advised on whether or not they need to be quarantined and tested.
So potentially entire classrooms then, quarantining?
Well, sure. I mean, anytime you have groups of folks together, right. I mean, that's the challenge of any gathering, when someone tests positive who's exposed to that gathering. But you can put barriers into that transmission depending on social distancing. Has social distancing been maintained at all times or most of the time? Are we limiting groups to small groups in school? With a virtual option, the class sizes could be much smaller. We're still working on those details. There's very productive, professional, thoughtful conversations going on right now between superintendents and public health experts about what back-to-school plans would look like.
One more follow-up question would be, people are calling you hypocritical that you're not holding in-person meetings for county, but yet you're still encouraging schools to hold in-person classes. What do you say to those people?
Well, I would say that, like I said before, I get called so many names I can't keep them all straight. And we can go through them all. There's a long list. But the county council determines their meetings. The county council is a separate branch of government. They determine their guidelines. They can determine whether or not they can maintain social distancing in the small room they have. They have to be 6 feet apart. They have to wear masks. But again, that's a decision made by the county council. They have the authority to do that. They're a separate branch of government.
Doctor, I don't know the powers of your office, but you said you'd like county schools to implement the at-home teaching via the computer. Can you require that in your position? Do you have the power for that?
No, the Department of Elementary and Secondary Education determines schools. I mean, certainly we, the county health department and the county government has interacts with schools on so many levels. We provide them with public health guidance, public health services, so many humanitarian programs, public safety, police are intermingled in the school. There's so many services we provide together, but currently our Department of Public Health directors and our medical experts are working with the superintendents to come together on best practices based on what we're seeing in the country, guidance from the Department of Elementary and Secondary Education, and an interpretation of the current state of COVID-19 in our community, which changes every week.
And Dr. Garza, I guess these are his numbers today, St. Louis County, 421 new cases. The kids are about 20 of those cases. That doesn't seem like a lot to warrant what you're requiring, or am I reading that wrong? Or what?
Yeah, so we talked about numbers yesterday. The day before, I think we had 140. The day before, 240. These numbers are going to fluctuate greatly every day. And there's three reasons, and that's why we have to look at the trends and we have to look at the averages. And there's a couple of things we look at, but and I don't know where the outbreak was. We might have had an outbreak surrounding a manufacturing plant that's built into those numbers. But the problem with those, the variability in those numbers, are that our tests are being reported in clumps. Some of our testing facilities get tests back to us in 5 to 7 days. Some of them report to the state, and the state gives them back to us, so there's even further delay. We're working to make sure all of those testing facilities provide their tests directly to us so we can react more quickly to them. And then some are providing them in 24 to 48 hours, and then over the weekend there's less testing available. So there's a lot of variability that causes those to come into groups. But the most important thing is to watch that 7-day trend. The 7-day trend of cases is going up. Hospital admissions is going up, ICU admissions is going up, ventilator usage is going up, and we have to watch that trend and make sure that we're making adjustments to keep that to a manageable level so our hospitals are not overwhelmed and that we can control the spread of the virus in our community.
Do you guys have any idea why this trend is going upward? I mean, are people not wearing masks?
Yeah, absolutely. If we could get compliance with masks across the board with our public health order, then we would be in a much better place. And a lot of this would get a lot easier. And that's why we issued a mask mandate a couple of weeks ago. We're working with our businesses to get compliance on that. But we need to get folks to follow our public health orders, follow our business guidelines, follow mask wearing when you're in a public space, and that will help turn these numbers around. And if we don't, then it's going to be much more difficult.
A couple things. What do you need to see as far as when you might loosen some of these restrictions that you're putting back in place? Is it a certain threshold of cases?
We need to see it going in the other direction.
But to what extent? I mean, do you need to see a 7-day holding period? What are the trends that you're specifically
Well, I think
looking for to tell
there are
parents?
many variables into this. And first of all, I talked to the Pandemic Task Force and Dr. Garza and other public health experts, but we have to see this going in the other direction before we would consider loosening restrictions. And we're not going in the right direction. We're going in the wrong direction.
So, I mean, there's not a plan in place, though, of saying we need to see 7 consecutive days of it declining.
Well, as a general rule, the standard is 14 days of declining cases. Hospital admissions, the hospital admissions is the best single data point, but there are many data points. We have to have adequate testing. And we have plenty of people doing tests in our community. The problem is getting the tests run, because the national testing framework is so overwhelmed, in a large part based on what's happening across the country, that the machines that run the tests are overwhelmed and they can't run the tests fast enough. And our tests from our community, although we don't have as many cases as the rest of the country, they still go to these same places to be run, and so we have to share space. So right now, some of the national testing labs are sharing the community cases with the hospital cases. They're going to run the hospitalized test first, and then the others after that, and the delay right now is 5 to 7 days.
Is it too simplistic to say that if adults, mainly adults or kids 9 and older, would follow all the rules, the kids could go back on the field quicker?
Well, we have to see the cases going in the right direction first, but it's not just the youth sports following all the rules. It's everyone else in the community as well, because the virus is still moving around the community on these other places. But right now, the hot spot from our contact tracers is in all the activities that are surrounding youth sports. And the hot spot in our country and our community right now is 10 to 19-year-olds.
I know you're talking about 10 to 19-year-olds and the surge in cases that we're seeing, but is there any direction that you're giving to, say, adult sports? I believe the Blues practice right in Maryland Heights. So can those?
They have an aggressive game plan. They have more resources than youth sports. They're testing, every day, every other day. They're quarantining their players. It's a very aggressive footprint, and even in those conditions, people still test positive. Even in those very aggressive quarantine-like positions where they're tested frequently, they still have positive cases.
So you're
and
still
high risk. Yeah. So they'll continue with their very tight procedures right now in professional sports, right?
You anticipate what will happen when schools reopen. You're talking about rooms that could be anywhere between 12 and 24 students in them. And there's not enough infrastructure in these schools to separate them out into more rooms, of course.
Well, some schools have more flexibility in space, but I think the important question surrounding schools right now is that there's a lot of very thoughtful conversation going on between people who are very serious about protecting kids. Those are superintendents, public health officials, teachers, and pediatricians are all involved in these conversations, coming up with plans to make sure kids are safe. We're all working hard on something that I feel strongly about, and that is a virtual option that depends on cooperation from the Department of Elementary and Secondary Education, and we believe we will get there. And we'll find a path forward. All the recommendations we're making today are based on the information we have today about where we are today in the COVID-19 infection rate. And so the things we do to get that turned in the right direction will put us in a better place for this fall. And that's why we have to start talking about what's important to us. Public health, safety, preventing loss of life, recognizing the economic impact, and then moving on to entertainment activities. And then we have to cut some of these things back that are linked to case reports and trends in the spread of COVID-19 in our community.
Dr. Gage, I may sound like a broken record, but I want to make sure I'm representing our viewers and their concerns. Have you given any direction, and I apologize if you already have, but have you given any direction to teachers who are just plain and simple not feeling safe enough to return back to in-person classes?
Well, I think that their concerns need to be heard, and I think they're part of the conversation, and that we need to make sure that schools are safe for kids and the teachers and all the staff, because they all have families they go home to, and kids don't need their teachers sick. So I think they're part of the conversation. They're working in these guidelines, and they need to be heard.
Would you give them the option of staying home, or how does that look for their choice when it comes to what their comfort level?
Well, there's a lot of complex issues in every employment situation about making sure it's safe for employees and making sure that the role that they have is accomplished in teaching our kids. And those things will have to be worked out with teachers and their school boards. But I think those conversations are ongoing. I think everyone is sincere about trying to resolve these questions, and I think that we need to hear what the teachers have to say and listen to their concerns.
So leave it up to the school board to decide.
Yeah, the labor management issues are managed by contract, sometimes collective bargaining agreements. I don't have the authority to get in that space. It's managed by labor law. But what we're trying to do is provide good guidance, encourage people to work together, and to find a solution that works for everyone, keeps our kids safe, keeps our teachers safe.
Thank you very much. So maybe a couple more questions. You might have already addressed this. How many contract tracers are currently working in St. Louis County, and do you think there are enough?
Well, there's over 300, and we're adding them every day. We have partnerships with St. Louis University. We have enough contact tracers now. We have a lot of applications for more people who want to work as contact tracers. We have a lot of very qualified people with medical backgrounds who are volunteering. Many of them are part-time that can flex up if we have greater need. And we're pretty proud of our contact tracing footprint here in the county.
There's one more question, it's off topic, but the Post-Dispatch is reporting that a group affiliated with Mark Mantovani paid for a lawsuit against St. Louis County. What is your reaction?
Well, it sounds a little shady. I don't know about it. I haven't read the story.
Anybody else have any questions?
No. Okay, thanks a lot.
Thank you.